most famous physical therapist on the internet.
All right. Hi, folks. I'm Bob Schultz, physical therapist.
Brad Heineck, physical therapist.
You're the most famous physical therapist on the internet.
In our opinion, of course, Bob.
Neck pain. Don't ever do this. Do this instead. We're going to give you the guidelines.
Oh, yes. Right from the therapist's mouth. It's kind of like the
To
horse's
your ears.
mouth.
That's right.
Carry on,
By
Bob.
the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, upload every day. And yes, you also want to always join us on our social media channels and also our website, bobandbrad.com, because we are always giving something away. Brad, what are we giving away?
The peanut vibrator.
Yeah, the FITINDEX vibrating peanut massage ball.
Yeah, it really is a nice unit. And are we going to show them how to do it? No, we don't.
You can turn it on real quick while I'm talking.
Okay.
So if you also want a shorter version of Bob and Brad, you can go to visit us on Twitter or Instagram. See how that thing's vibrating?
Well, they can't see from here, but boy,
put it on the floor. They can see it moving.
That's right.
There we go.
This would be good for parties too.
That's right. Okay, let's move on, Brad.
Yeah.
All right. What are we talking about, Brad?
Oh, neck pain or neck stretching in general. This is one of those things. As a therapist, I've been to a number of fitness classes throughout the years, and one of the big misconceptions instructors will say, never look up, don't stretch your neck backwards, it's going to give you serious problems. There's nothing further from the truth, with the exception of if you do that and you get dizzy or lightheaded, then that's a big red flag. Do not do it then. But we're going to show you how to do it properly in just a little bit. But there's
actually a whole treatment protocol based upon that you do. And in fact, I saw a study, Brad, where if you work on neck extension, it actually improves your motion in other directions.
Right.
That was done at the University of La Crosse.
Yeah, Dr. Fader was involved with that. Yeah.
Yep.
Anyways, we're going off on a tangent. Yeah. So we're going to get into a little more details, but just wait. You could fast forward if you want, but we've got things you should never do with your neck for stretching. And I've seen people advocate this stretch as well. So what stretch are we talking about, Bob?
Flexion.
Flexion, in other words, going forward with your neck. This isn't bad to do this. You look down, but if you're going to do this as a stretch to get these muscles, these tight muscles loosened up, and you do this, and then you add stretch like this, there's
really little benefit to that, and it could be some harm.
Over 23 years of being a therapist and doing a lot of neck pain, I have never said to anybody, stretch your neck like this.
You might go off to the side.
Right.
You might go like this and to pull on the trap a little bit.
Yeah.
And we've even shown this stretch before.
Or that levator scapula.
But going straight down, I mean, the fact of the matter is, throughout the day, half the time your neck is down like this, looking at your phone or looking down at your computer or whatever you're doing.
Right.
And so there's no reason to stretch it that way. It's already stretched out that way.
Right. Exactly.
You need to stretch it in the opposite direction.
So anyways, so we got that out of the way.
Right.
And the other thing is do not ever stretch your neck. If you want to be able to look over your shoulder better, which is a common way necks will tighten up, particularly as you age, that's a good stretch. But if you do that stretch in a poor seated posture.
Yeah, I'll go to the side, Brad, here. So
okay.
You want to use a stool?
Yeah, I'm going to.
That's a good idea.
So if we're out of posture and the neck and the spine is rounded, you cannot do an effective and a good quality stretch. It actually puts stress on the neck and the cervical spine so that you can injure yourself doing that.
Absolutely. You want to be as straight up. In fact, a lot of times what we tell people is do a chin tuck first, and then work on a rotation.
Which is one of the 3 things you should do. So should we get right into that?
So again, just to repeat, don't do straight flexion. Don't do rotations with the neck forward, with the forward head.
Yep. Which rounded shoulders, rounded back, all that is poor posture on the spine. You're going to get things.
We're going to do these instead.
Injured. Yes. So the first thing is, no matter with all 3 of these exercises, first thing you want to do is get yourself up. Arch the back, shoulders back, head over the shoulders, get that spine in good, proper alignment. Then you can start working some good stretches on your neck.
When he says head over the shoulders, a lot of times you can line up the ears with your
Yep.
shoulders. That's
Yep.
going to be a good sign of that
There
you're
you
in the
go.
right
So I can
position.
have my shoulders back like this, but if I'm forward, that's not good. Bring
Right.
it back, which leads us to the first stretch.
Right.
If you're tight that way and you can't do that, the chin tuck going in like this is a nice way to stretch the neck. If this hurts, it means you probably got a tight neck or you maybe have a problem, but it should just feel like a stretch. And you can give a little over pressure. You can right on your chin, gently push in like
And
this.
you're not going up like this. You're not going
Mm,
down like this. You're just
right.
going straight back. And
Right.
you'll feel that this is the part that'll stretch the right below the skull here.
Yep, the
And
suboccipital muscles we call them.
So if you want to stretch that area, instead of doing this,
Yep.
you do it this way.
There you go,
And
Bob.
the neck is safe while you're doing it. I was trying to nape is sec. I was trying to reverse the words there, Brad. Okay, let's keep moving.
All right, so you can do that 5 to 10 times. You can do that throughout the day often. It's a nice way to maintain good posture, keep that stretched out. Now, the second one is you really should have a chair with a backrest. Okay, Bob, you want to pull that one out?
Sure.
And it also is helpful to have a towel roll. Just a bigger towel works better. Not a little hand towel. You want to show, Bob?
Sure.
It'll show up
So
good on your shirt.
I'm going to show first without the towel.
Sure,
So you're
yep.
in a good position here, good posture.
Yep,
And then you're going to start working on neck extension.
yep,
Now, for some people, this might be a little bit painful, especially if you have a sore neck.
yep.
So the way to start it quite often is to actually use a rolled towel. We got
Mhm.
some tape around it. That's just to keep it in place, but
Yep.
you don't need to do that. And one easy way to do it is to actually just grab the ends of the towel and pull down like this and then work back.
Yep.
And I've got my back supported up against the upper back of the chair.
Yep. So
You don't
can
want a
relax.
springy back. You want a nice solid back.
Yep.
And I can work on it. And I can, if I hit pain, I back off.
Yep.
This is not a, no pain, no gain thing. We always want to stay away from the pain. We don't need it to trigger
Right.
any ongoing pain.
And again, if this creates any dizziness or lightheadedness, you need to stop doing that.
Right.
Then I would actually probably, go see a doctor and let them know that there's a problem with that.
Yeah,
Those
but
symptoms.
interestingly enough, a lot of times as you regain full motion, your pain levels start to
Oh,
go down
right.
in your
Yeah.
neck.
I've had
So,
this so successful. And oftentimes people do this, they'll not only feel pain in their neck, but it refers down into the shoulder blade area, and it reduces and goes away as the range of motion improves.
it
5
seems
to
that
10 repetitions, and you can do this one throughout the day, every couple hours, as long as you're
exactly.
making good progress.
Exactly.
And finally, if you're having problems with rotation, looking behind one way or another, again, good seated posture. It's nice to have a backrest again, and then you can work on your rotation to the right
And
and
I
to
kind
the
of
left.
always do a chin tuck first,
Yep.
and then I work on the rotation.
Yep.
And then I work on the rotation. I'm going to show a video next week, Brad, on how to increase your rotations.
Oh, good. Because there's a lot of. We're not going to go through all the tricks to do this. This is a basic one.
Right.
And you can put put your hand on your jaw and give a little additional over pressure, but not too much. This should be gentle stretching. You're not
And
trying
it should
to.
not be painful.
Right. Just
So
feel a
it
stretch.
should feel good to actually give a little more extra stretch.
And if you
So,
do that 5 times each direction, it'd be a total of 10. I think that'd be a good place to start. But again, that posture is so important. And you'll find, and now if one direction is painful and the other one isn't, work the non-painful side and then go back to the painful side and see if it improves. But again, like Bob said, this is a no pain, no gain. You want to
stay away from the pain.
Yep, stretch it and let the pain relieve itself as we gently
Yeah, we
stretch
don't want to
into
fire
it.
things up. Nerves become sensitive to pain if you keep firing them up.
Right,
And all of a sudden, it doesn't take hardly any motion at all to
right.
set them off.
So good
So,
judgment, and keep listening to us and watching our videos. And we'll, like next week, we're going to have the detailed one about rotation.
yep, on
stretching.
rotation. I promise.
And he's getting fidgety. We're going to have
Yeah.
to cut off now
All
because
right.
this happens every now and then.
Thanks for watching.